So my patient was just asking me about how long she can stay on HRT. She's been on it for many years with me, I think about 7 or 8 years, and she's doing really well. We're down to annual appointments now where we do bloods once a year to check her levels. She's just had a pelvic ultrasound scan to make sure the lining of her womb is thin and her ovaries are looking healthy with no pathology, and she has a mammogram every couple of years or so, and the last one was also just a few weeks ago and was normal, which is great news. She did actually stop her hormones because she ran out for a couple of weeks, and she noticed she was more tired, her sleep wasn't as good, and it really caused the flattening in her mood. And this is someone who works, she's got a family, so she needs her energy and her get up and go. So I let her know that the guidelines have actually changed, that if you're feeling well on hormones, you can continue them long term. Now, my caveat is that this should be long term while being monitored. So all those things I just mentioned, pelvic scans, mammograms, a blood test, an annual review, blood pressure check, I think they should be done on an annual basis just to make sure the hormones aren't causing any negatives. And of course, if you did notice any new symptoms, I'd like you to please contact me before a year, not wait for a year to let me know that. This is something I've been doing with my patients for quite some time. I sometimes also do an estrogen metabolism test to make sure you're breaking down the hormones correctly. And for patients who are able to, just some good general health markers are always useful. So looking at sugars, cholesterol, blood count, liver function, kidney function, thyroid health, iron. I think that to me is sort of your ideal once a year well woman sort of approach that I would take with my patients once they're stable on their hormones. So I hope that's helpful. And yeah, the guidelines have changed. So if you do have a doctor who is saying that perhaps you shouldn't stay on the hormones, it would be okay to question that and try and find out why, just in case they're not up to date with the most current guidelines. Take care. Bye.